As the rebuilding process continues after the deadly wildfires in January, new data is painting a broader picture of just how many lives were lost because of them. Now, 30 people lost their lives during the fires in the Pacific Palisades in Altadena. But a new study is showing many more people died because of effects related to the fires.
And joining us this morning to talk about the new study in the journal JAMA is Associate Professor at Boston University and author of the study, Andrew Stokes. Andrew, thank you so much for joining us.
Thank you for having me.
Absolutely. And can you tell us what you found when looking at this data from the weeks after the fires?
Well, thank you. We all know that this was a terrible tragedy for Los Angeles and for neighboring counties. However, it's very hard to attribute deaths to a wildfire. And those 30 confirmed deaths really only scrape the surface of the tragic toll of the LA wildfires. In our study, just published in JAMA, we estimate that at least 440 deaths were actually attributable to the wildfires, putting the real burden far above the official toll.
Wow, that's so many more, I think, than anyone would anticipate. And what were those deaths due to?
These deaths are not only attributable to the direct effects of the wildfires, which include those 30 confirmed deaths, but also people living with lung or heart conditions whose disease was exacerbated by smoke or stress, as well as indirect deaths, such as from disruptions to health systems and mental health impacts.
Thank you so much. And so what are you thinking? Does this continue, or was that the end of it?
Our study in JAMA only studies the acute wildfire period over those first few weeks of January. Prior research on other natural disasters and wildfires has established a long tail of many of these disasters, and thus further research will be required to understand increased risk for cancer, respiratory conditions, and other diseases as time passes.
Well, going further on that point, Andrew, can you describe what kind of health effects did you see that contributed the most to the rise in these numbers?
Well, look, as we all know, the wildfire smoke contains many toxic substances and particles. So those who were on the front lines, as well as affected communities, were exposed to many things that could increase their risk for disease later on. So additional primary data collection will be needed to really tease out those effects. But it's important to note that these effects may take years to manifest.
Yeah, and so seeing that number rise from 30 to 400, what changes in public health data do you think should happen after your study? How should this be reflected so that it's accurate?
Thank you for that. It's very hard for medical examiners and coroners who do such good work, but these systems are stressed during acute natural disasters, so it's very difficult for them to fully process what has happened in real time. So we need just more routine mortality surveillance and surveillance of disease systems to understand what's happening as close to these events as possible so that FEMA and other agencies can respond and help provide support.
Absolutely. Thank you so much for joining us, first of all, this morning, Andrew, and thank you for the work that you're doing.
Thank you very much for having me.
All right, we appreciate you.